Good evening, sir. Good evening, class. The natural history of disease refers to the progression of the disease process in an individual over time in the absence of intervention without treatment or prevention. It describes the stages through which a disease develops from the initial exposure to the causative agent, through the pathological changes, clinical manifestations, and finally recovery or disability or death. It helps epidemiologists and public health professionals understand when and how to intervene, prevention, early diagnosis, treatment, the best points for screening and control measures. Stages of the natural history of the disease. Stage 1, stage of susceptibility. Before exposure, the host is at risk. Stage of subclinical disease. After exposure but before symptoms, pathological changes begin. Stage of clinical disease, signs and symptoms appear, diagnosis possible. And the fourth stage is the stage of recovery, disability, or death. That's the final outcome. The natural history of leptospirosis. It is a zoonotic bacterial infection caused by Leptospirea intergrolans and related species. It is transmitted mainly through contact with water, soil, or food contaminated with the urine of infected animals, especially rodents. To apply the stages, stage 1, susceptibility. Individuals at risk are like farmers, sewage workers, veterinarians, people in flood-prone areas, or those exposed to contaminated water. Exposure occurs via skin abrasions or mucous membrane in contact with contaminated water or soil. The stage of subclinical disease, incubation period. Typically 7 to 12 days, the bacteria enters the bloodstream and multiply. The person is asymptomatic during this period. The stage of clinical disease, leptospirosis often has a biphasic course. A. The ischemic phase, duration 4 to 7 days. Symptoms will include sudden fever, chills, headache, confusion, muscle cramps, calf muscle especially. This may resolve or progress to the immune phase. The immune phase duration may follow 1 to 3 days of apparent recovery. Antibodies appear, organism localized in organs. Symptoms, irritation, jaundice, renal dysfunction. And the fourth stage, recovery, disability, or death. Mild cases, complete recovery within weeks. Severe cases may result in renal failure, hepatic dysfunction, or death. Thank you.